Hi, my name is Kathy Kemp, Director of Nursing for Ottawa University. One of the ways that we support practicing nurses in our community is by providing continuing nursing education credits. Here's a quick sample presentation for this month. Recognizing February as National Heart Month, this presentation focuses on getting to the heart of good foot care, avoiding foot complications in your diabetic and PAD patients. The objectives here are to discuss risk factors for foot complications in patients with diabetes and peripheral arterial disease, or PAD, also known as PVD, peripheral vascular disease. Identify the most effective way to screen patients for foot complications. Verbalize the key elements of appropriate foot care, and describe the learning needs of patients with diabetes and PAD towards foot care. So the definition of PAD, peripheral arterial disease, artery disease, is a narrowing of the peripheral arteries to the legs, stomach, arms, and head, most commonly in the arteries of the legs. We know that patients that are at risk for PAD are also at risk for coronary arterial disease. And this is related, obviously, to the narrowing of the arteries, most often related to arterial sclerosis, which blocks the blood flow in the arteries. People with PAD have a much higher risk of heart attack and stroke, again because of the link with PAD to coronary arterial disease. So what is one of the primary risk factors for peripheral arterial disease? If you guess smoking, of course you're right. Smoking, obviously the nicotine causes vasoconstriction. It increases the carbon monoxide content in the blood. That carbon monoxide is produced by smoking, and that carbon monoxide reduces oxygen levels and thickens blood, which in turn damage the endothelial cells and the linings of the blood vessels. Other risk factor, diabetes. Actually, anymore when we think of a diabetic, we also want to think of potentially coronary arterial disease and or peripheral arterial disease. Obesity is a close second, as well as increased age, high blood pressure, high blood cholesterol, and a family history of arterial sclerosis. We are now living in a diabetic epidemic in the United States and around the world. Diabetes has quickly become known as the other silent killer, a close second to hypertension. We knew that as the primary silent killer. Diabetes is actually prevalent in 1 in 4 people that have it and they don't even know that they have it. Diabetes or high blood glucose levels leads to arterial sclerosis, which again, as we mentioned, is a primary factor for arterial disease, coronary, cerebral, and peripheral arterial disease. Peripheral arterial disease causes changes in the lower extremity. Patients may complain of cramping in their calf, known as intermittent claudication. Skin of the foot could be dry, cool. A diminished or absent pulse could be present. In extreme cases, in severe PAD, there could be noticeable changes, cyanotic changes in color to the skin, which would be considered a limb-threatening emergency. We'd also want to look for non-healing wounds in a patient that has PAD. They are at risk for those. It could actually start as an injury and would fail to heal in a normal period of time. These patients, again, fail to heal because of the decreased blood flow to the foot and to the toes. Prevention is key when we want to educate these patients to prevent any foot complications in the first place. So we would want them to check their feet daily and follow the other preventative foot care routines that we teach all diabetics as well. Thank you and have a great day. If you or your organization have any questions, please contact me at kathy.kump@ottawa.edu. Thank you for watching today, and thank you for your continued commitment to our wonderful profession of nursing.